hair thinning, receding hairline, and hair loss. A common, albeit frustrating concern for men all over the world. Everyone likes having thick, voluminous hair. But sometimes, even if we are born with good hair, we lose the density and thickness, or we start to go bald in places, which can be pretty annoying. So today, we're going to dive into the reasons why you're losing hair and provide you with steps you can take to reverse this damage or avoid it and get your hair thick, full, and healthy. There are 3 primary reasons for hair loss, especially when it comes to men. 1. Androgenetic alopecia or male pattern baldness. 2. Medical conditions such as lupus, thyroid issues, and alopecia areata. 3. Stress and diet. Androgenetic alopecia, or male pattern baldness, is the most common reason for hair loss in men, affecting over 50% of all men over the age of 50, all around the world. And it's due to 2 factors: genetics and hormones. Genetics. You inherit genes from both of your parents that can make your hair follicles sensitive to a hormone called DHT or dihydrotestosterone. DHT shrinks hair follicles over time, leading to thinner and shorter hair, eventually stopping growth altogether. Hormones. DHT is a byproduct of testosterone, so as men age and testosterone levels fluctuate, hair loss can become more noticeable. Thankfully, compared to several years ago, there are now actual remedies for this. Keep on watching the video to learn how you can reverse and regrow your hair affected. Certain medical conditions and medications can contribute to hair loss as well. An underactive or overactive thyroid can increase DHT synthesis and disrupt hair growth cycles, and may eventually cause total loss of the hair follicle. Conditions like alopecia areata can also attack hair follicles, causing patchy hair loss. Some medications, such as medication taken for high blood pressure, arthritis, and depression, can have hair loss as a side effect. While not directly causing hair loss, stress and diet certainly contributes to the problem. Severe or chronic stress can disrupt your hair growth cycle, leading to shedding. Diet issues, such as deficiencies in iron, biotin, zinc, and even protein, can impact hair health and contribute to hair thinning and hair loss. So how do we reverse this? Thankfully, there's now treatment options you can take apart from the traditional hair transplant surgeries. The top 2 medications on that list are Minoxidil and finasteride. These are both FDA-approved medications that you can take to treat hair thinning and loss. Minoxidil helps stimulate hair growth and slow down or reverse hair loss by increasing blood flow to the hair follicles and potentially prolonging the hair cycle's anagen or growth phase. Finasteride can block the conversion of testosterone to DHT, slowing down hair loss progression. 9 out of 10 men who took minoxidil has had hair regrown in areas that were thinning or was balding, and has also reported a considerable decrease in hair loss in a matter of weeks. For the best results, we advise using a derma roller before you apply minoxidil, as it helps the minoxidil get absorbed into the scalp better. For minoxidil, we recommend Provilis for men, as it has 5% minoxidil concentration compared to the 2% that most brands have, as these brands are made for both men and women, and since a 2% minoxidil concentration is the recommended dosage for women. You can check it out from the link in the description. But remember, it does not happen overnight. So be patient with yourself, and make sure your diet and stress levels are managed to the best of your ability. If your hair loss was not brought on over time, and was sudden and is shedding in patches, consult a doctor to help you understand the underlying causes for your own situation. Comment below if you have any questions. Have an incredible day.